I expect, impact investing to grow tremendously as a result of the pandemic and, the extent to which we are all really aware of how much we live in an interconnected world. And like climate change affects us all, clearly pandemic affects us all. It's stunning to be living in a world where the entire world is sheltering at home. The entire world economy is at risk, and the health of people around the world are at risk. So we see those huge needs. They present opportunities for investment. One way to think about this is private equity, venture capital, impact investing, typically in earlier stage companies that have a very clear and direct social or environmental mission. They are producing products and services that are absolutely designed to make money and to help solve major social or environmental issues. Other people may focus and say, that's good, impact investing in private companies makes lots of sense, real opportunities to grow those companies, make a profit. But what about the public markets? I want to invest in public markets. In that space, we typically think about ESG investing, investing while considering environmental, social, and governance standards, and how is the company performing in that realm. And there are other variations on impact investing. We may think about investing with a tolerance for more concessionary returns. Like people who are investing, foundations and others that are investing with an intent to break even, but maybe not to make a lot of profit. So we talk about the range of these things, and there's been a tremendous growth and interest in using the tools of finance and investing to have a positive social and environmental impact. In part, I think because people have grown concerned that government and philanthropy can't do it. And at the same time, they've seen that, hey, this seems to actually be good for business. We can make money this way. And our consumers are expecting this. Our employees are rewarding it. Certainly at the Wharton School, we know that our students want to have an impact. They don't want to just make money. So the field has grown in all of these ways over the past 10 years. And I think we're just going to see more growth as we come out of the pandemic. We need to be much more thoughtful about public health and the kinds of health risks that we incur. And, some of this, I think, is thinking about, let's make sure our hospitals have plenty of PPE, personal protective equipment. But it's also thinking about, other aspects of public health. Do people have access to decent hospitals? Are nurses trained? Are other health care workers up to speed on the latest information? What can we do to grow telemedicine? So as we think about preparing for a pandemic, there are real need and opportunity to grow businesses in these areas and to bring private capital to grow these things. So while we can think about growing, and supporting businesses that are directly related to public health, we also have to remember that people who are at the greatest risk of COVID-19 and other health crises are poor. Are people of color living in poverty, living in denser housing, having more limited access to good jobs, having limited access to safe and affordable housing, having limited access to loans to maintain their businesses. So it's not just investing in healthcare, it's investing in all the things that support our health and resilience. So I think one of the things that's been very interesting to people who are interested in impact investing and innovative finance are these collaborations, these cross-sector collaborations. And so between businesses, universities, governments, and other institutions, the nonprofit. And we've seen these, for example, when we look at social impact bonds that have been experimenting in how do we bring private finance to governments and nonprofits to grow the most promising initiatives. I expect we will continue to see those kinds of innovations, that a crisis like this really brings, creates and necessitates innovations, and we will see innovations in all sorts of things. We're seeing innovations at Wharton in online education. we'll see innovations in finance and in collaborations, a range of innovations that to address the kinds of crises we're really seeing. We're excited about these to see what our students are doing, and students are, stepping up to, for example, innovate and develop, PPE. But we also have opportunities. We're exploring collaborations with Penn Med to advance impact investing in the local community. We talk a lot about the social determinants of health. It's not just about your genetics. It's not just did you get to see a doctor. It's about underlying health conditions. And as I said, these things have everything to do with the quality of employment people have, the quality of housing people have access to. So I'm excited to see what we're doing within Wharton and across Penn to collaborate and think about what's the business angle, what's the public health angle, what's the social impact angle, and how do we accelerate to do good in our local community and beyond. They have a major social and environmental impact when we look at what's the quality of the businesses in the supply chain, what's the nature of those relationships, and are these businesses in the supply chain, are they able to withstand crises like these, whether they are environmental crises, political crises, or health crises, and I mean, I think that's part of the message that we get from COVID-19 is we live in a very interconnected world, right? The health of my business is dependent on the health of your business. The health of my community is dependent on the health of your community. And some communities are at much greater risk than others, but none of us are untouched by these things. And that's very much true. That's true whether we're talking about supply chains or, individuals' health or national economies. I'm optimistic when I look at impact investing in private equity and venture capital in smaller focused businesses and the opportunities there for innovation to make a difference, and all the evidence that we have that you can actually achieve profit with purpose, that those are simpatico, synergistic, not antithetical. But I'm also optimistic when I look at public markets. And, we've talked about, when we talk about ESG, for years, we've been paying, I would argue, more attention to to environmental factors. And I think this crisis says social factors, and particularly how companies treat their employees, warrants a tremendous amount of attention. Are companies paying living wages? Are companies providing health care? Are companies providing maternal and paternity leave? So I think investors are going to be paying more and more attention to how do companies measure up on those dimensions as well. And I think consumers are going to want to frequent those businesses that are doing a good job on those dimensions. As we start to get out of sheltering at home and start frequenting businesses, we want to go to businesses that treat their employees well and that have been engaged in the community and that have shown leadership and integrity. So I think there are a lot of forces that combine that say we have an opportunity here, and as I said, I feel optimistic that we're going to have businesses engaged in doing good for a lot of reasons. They will look different in different communities, but as you said, and no community is untouched, and certainly no community is untouched by the health risks, but also by the economic fallout. So I also think we will see a lot of concerted effort to do what people refer to as place-based investing. How do we invest to build the local economy? How do we invest in small businesses? And we have an opportunity to invest in small businesses that are good employers, that offer high-quality jobs, small businesses that have been launched by women, by entrepreneurs of color. So there's an opportunity to rebuild communities in a way that is good for the economy, and I hope as well good for inclusion.